Assalamu alaikum everyone, Dr. Maria here. Today we will do breech presentation, and it is most common malpresentation. If the examiner will ask you any question from malpresentation, 99% chances are that he will ask the questions from this topic. So never ever miss this topic or leave this topic on choice. So let's start. So what is meant by the breech presentation? It is type of malpresentation which means that the buttocks, knees and the foot or feet directly overlies the pelvis, right? So mostly the buttocks of the baby lies directly on the maternal pelvis. Normally what happens? The vertex lies directly over the maternal pelvis. In Urdu what we say? We say ulta bacha. So breech presentation mean bacha ulta hai. Now before going into detail of breech presentation, first of all you should know about the fetal lie. Fetal lie can be longitudinal, it can be oblique, it can be transverse. In picture A, the long axis of fetus is parallel to the long axis of uterus. Mean the fetus is in vertical direction. So here the lie is longitudinal. So in OSCE you should know about the lie is longitudinal. In picture B, the long axis of the fetus, if I draw like this, is parallel to the long axis of the uterus. So again the lie is longitudinal. You cannot say that the lie is breech, right? What is the definition of lie? First you have to draw the long axis of the fetus and then you have to compare it with the long axis of the uterus. So you have to find out the relationship between them. So in picture B, the long axis of the fetus is parallel to the long axis of the uterus. So here the lie is longitudinal. So first correct your terminologies. In picture C, the long axis of the fetus is making an angle of 90 degrees with the long axis of the uterus or is perpendicular to the long axis of the uterus. So here the lie is transverse, mean the baby is present in horizontal direction in the uterus, right? Now in picture D, we can see that the long axis of the fetus is making an angle of 45 degrees with the long axis of the uterus, mean the baby is present obliquely. So the lie is oblique. So the lie can be longitudinal, it can be transverse, it can be oblique. So first clear this concept. So tell me, what is the normal fetal lie? Normal fetal lie is the longitudinal lie, and the oblique and transverse lie are the abnormal fetal lie, right? So both of these lies are abnormal. When lie are abnormal, the presenting part will also abnormal. Mean oblique lie is abnormal lie, and in oblique lie the presenting part is shoulder, and shoulder presentation is a malpresentation. And here in transverse lie, as the lie is abnormal, the presenting part can be shoulder, it can be back, it can be ribs. So the presenting part will be abnormal, because the normal presenting part is the vertex. Vertex should first come into the maternal pelvis, but in transverse lie, the shoulder, back or the ribs will first come into the maternal pelvis. So in transverse lie, the presenting part will be abnormal. So in transverse lie, there will be malpresentation. So clear your concept that transverse lie and oblique lie are abnormal lie. And in oblique lie and in transverse lie, the fetus will present with malpresentation. I have discussed in detail about them in lecture 2 and lecture 3 of malpresentations, so kindly watch that lecture. Now what is the normal fetal lie? Longitudinal lie is the normal fetal lie, right? But in normal fetal lie, the presenting part will not normal always. The fetus head can first go into the maternal pelvis, mean there can be cephalic presentation or a head presentation, or the fetal buttocks can first overlies into the maternal pelvis, or the fetal bottom can first overlies into the maternal pelvis. Mean mostly the buttocks can first overlies into the maternal pelvis. So there can be breech presentation. So in longitudinal lie, the presentation can be cephalic, it can be breech. Breech presentation is a malpresentation. And if head is going first into the maternal pelvis, for example, on abdominal examination, you are telling to the examiner that the lie is longitudinal and you are feeling that the head is going down towards the maternal pelvis, or you say that there is a cephalic presentation, does it mean it will be normal presentation? The answer is it can be normal, it can be abnormal. What it's mean? In longitudinal lie, the presenting part can be head, mean it can be cephalic, it can be breech. We know that breech is a malpresentation, right? The fetus will have longitudinal lie and abnormal presenting part, mean there will be malpresentation. But in cephalic presentation, if head is going first into the maternal pelvis, we have to see that which part of the head is first going into the maternal pelvis. On abdominal examination, we can say that it is a cephalic presentation, or first is head downward or going into the maternal pelvis first. But on ultrasound or per vaginal examination, you can tell that exactly which part of the head is going first into the maternal pelvis. Mean all the cephalic presentations are not the normal presentations. Here is the example. Please clear your concepts. In all these three pictures, the lie is longitudinal, right? And second thing is that the head is first going into the maternal pelvis, and head is called cephalic. So lie is longitudinal, and in them the presentation is cephalic. So in picture A, the fetus has longitudinal lie and there is a cephalic presentation. If examiner asks you what is a normal lie, you say the normal fetal lie is longitudinal. And if he asks you what is the normal presentation, and if you say that cephalic presentation is a normal presentation, you are saying right. But a very good doctor should know more than this, because every cephalic presentation is not a normal presentation. That is a broad term. For example, here the head is going down first into the maternal pelvis, mean it is a cephalic presentation. But on vaginal examination or on ultrasound, you can tell exactly the point which is coming into the maternal pelvis. Mean normally the vertex, which is the area between the anterior fontanelle and the posterior fontanelle, should come first into the maternal pelvis. And on vaginal examination with fingers, you should feel the occiput of the fetus. Then it will be normal presentation. Mean this area between the anterior fontanelle and the posterior fontanelle should first come into the maternal pelvis, and with fingers you should feel this bony part, that is the occiput. Then this presentation will be normal presentation, and you will say that it is the vertex presentation, which is a normal presentation. Now in picture B, we can see that head is going first into the maternal pelvis. But on vaginal examination, we will feel the frontal bone first. Mean the forehead will first come into the maternal pelvis. Forehead is a part of head. So on abdominal examination, you can say that it is a cephalic presentation, but when you will do the vaginal examination or ultrasound, you will say that it is not the normal presentation, it is a malpresentation. Why you are saying the malpresentation? Because the forehead is coming first into the maternal pelvis and you are feeling the frontal bone on vaginal examination. Now in picture C, the head is first going into the maternal pelvis, right? And so again, on a broader term, we can say that it is a cephalic presentation. But on ultrasound and on vaginal examination, you will feel the chin first, or you will feel the mouth, you will feel the malar bones or the nose, and you will say that you are feeling the face of the baby. So here the presenting part is face, and face presentation is a abnormal presentation. So the lie is normal. The presentation is cephalic. But when we zoom the concept, we come to know that all the cephalic presentations are not the normal presentations. What we should say? We should say that vertex presentation is a normal presentation, right? While the brow and the face presentation are the abnormal presentation. It means that whenever you do abdominal examination, you cannot say confidently that the presentation is normal. On B examination, you write down that the presenting part is head, but actually you have to do ultrasound and vaginal examination to feel the actual point or to make the diagnosis. So in longitudinal lie, the presentation can be cephalic, mean the head first can go into the maternal pelvis, or it can be breech. And in cephalic presentation, there can be vertex presentation, which is a normal presentation. There can be brow presentation, there can be face presentation. So in a nutshell, you can say that the normal fetal lie is longitudinal and normal presentation of the fetus is vertex presentation, right? Now we will do the breech presentation. So in breech presentation, the lie of the fetus is longitudinal and the presenting part is bottom of the baby. It can be buttocks, it can be knees, it can be feet or foot. Now very important question, that what is the incidence of breech presentation? Incidence varies according to gestation. It will be 20% at 30 weeks, falling to 4% at term. Mean when the fetus is smaller, it can easily change his position, right? So you should know that the incidence of breech presentation at term is 3 to 4%. Now what are the causes of breech presentation? The general causes of malpresentation also applies for the breech presentation. You can divide it as the maternal cause, placental cause and fetal cause, and you can remember them with the help of mnemonic that I have given in a separate video. So link is given and kindly watch that to remember these causes with the help of mnemonics. Otherwise this video will be very long. What are the complications of breech presentation? These are some complications which are related to the breech presentation, like cord prolapse, uterine rupture, obstructed labor, fetal hypoxia and death, and maternal mortality. These complications you can also write in all types of malpresentation. So memorize them. Now, what are the types of breech presentation? And this part is very important. Main types of breech presentation are complete breech, which is also called as flexed breech. It can be extended breech or also called as frank breech. It can be footling breech or also called as incomplete breech, right? Knee breech is also a type which is very rare. So we will discuss these three types. In complete or flexed breech, both the hips and knees of the fetus are flexed. So remember this thing. In this breech, there is a complete flexion. So you can see here, there is a flexion of hip due to which thigh move forward, and there is a flexion of knee, right? Due to which leg is flexed. So thigh is flexed, leg is flexed, or we can say that hip is flexed and knee is flexed. When I was in MBBS, this was the most favorite question of my ma'am, right? She always asked that, tell me the type of breech presentation in which both hips and knees of the fetus are flexed. So it is the flexed breech or the complete breech. Now, do you know that what is meant by the flexion of hip and what is meant by the flexion of knees, or what is meant by the extension of hip and extension of knees? Because it is very important to know here in order to understand this concept. So just have a look. Now first of all, we will talk about the flexion and extension of hip. When there is a flexion of hip, the thigh moves forward, and when there is the extension of hip, the thigh moves backward, right? But when there is a flexion of knee, the leg moves backward. But when there is the extension of knee, the leg moves forward. So it is different for both of them, right? Now in this picture, the thigh is in forward direction, mean there is the flexion of hip, and the leg is in backward direction. So such type of breech in which both hip and knee are flexed, or we can say that the thigh and legs are flexed. So as both are flexed, so it is a complete breech. And you can see that here it has a shape of C. So C for complete breech, right? Incidence is very important. It is up to 5 to 10%, and it is more common in multi-pares. Now we have extended breech, which is also called as frank breech. In this presentation, the hips of baby are flexed, or we can say that the thighs are flexed and the knees or legs are extended. We can look in the picture, the hips are flexed, right? Due to the flexion of hip, the thighs will move forward, but there is the extension of legs, because due to the extension of knee joints, the leg move forward. So in extended breech, there is a flexion of hip joint, or we can say that there is a flexion of thigh, and there is extension of knee joint, or we can say that there is extension of leg. So flexion of thigh, extension of leg is present in the extended breech or frank breech presentation. So if hip joints or thigh are flexed and legs are extended, you will have frank breech or extended breech presentation. Now we have footling breech, which is also known as incomplete breech, in which one or both hips are slightly extended, due to which one or both feet are the presenting part, right? As in complete breech, the hip joint and the knee joint are flexed and the feet are above the buttocks. In order to get the footling breech, there must be some extension at hip joint. So there must be some extension at hip joint to get the footling breech. In this type of presentation, there is some extension at the hip joint and foot is the presenting part. Incidence is important. It is about 10 to 30% at term pregnancies. And the most important question is that the complication that is associated with it. Footling breech is mostly associated with cord prolapse, and it is about 5 to 10%. As we know that in all types of malpresentations, cord prolapse is a complication, but it is mostly associated with footling breech. In order to memorize the types of breech presentation and the extension and flexion of hip and knee joints in them, there is the mnemonics or short story of breech presentation. This is the story of 3 friends who are spending time on beach. So on beach, there are 3 friends. One of them is so frank that he is sitting with extended legs. One is complete shy, sitting flexed. And one is running after football. So note the attitude of 3 characters. How we will decode this story? As this is about breech presentation, so here, this breech came from the word breech. So whenever someone asks you about the types of breech presentation, Just think about this speech and these three characters. There are three friends, mean there are three main types of breech presentation. So number one of them is so frank that he is sitting with extended legs. Here, extended mean extended breech, which is also called as the frank breech. Now, when you are comfortable with someone or when you are frank with someone, how you sit? You sit relaxed, comfortable. So he is sitting comfortably with the legs up. So remember the picture of extended breech that is given in your textbook. That is like this. So, in frank breech, the fetus has extended legs. When legs are upward, it means that there is the flexion of hip and there is the extension of legs. So in extended breech, or we can say that there is the flexion of hip joint and there is the extension of knee joint. Also, as the legs are upward, and if I draw a line like this, it look like F. So extended breech is also known as the frank breech. So this F mean frank breech. Now, other friend is complete shy, sitting flexed. When you are shy, you have a posture like this. So here the word complete mean the other type of breech presentation is a complete presentation. In complete breech presentation, the hip joint is flexed and the knee joint is also flexed, right? If I draw a line on this, it look like C. So C mean complete breech, in which there is a flexion of thigh and there is a flexion of leg. Now the last friend is running after football. So here the football mean footling breech. So the last type is the footling breech. And you know what? This friend is always interested in games and still his homework is incomplete, but he is playing football. So he has not completed his homework yet. So such type of breech is also known as incomplete breech, right? And note this leg. There is some extension at hip joint. So in footling breech there is some extension at hip joint. While in extended breech and complete breech, there is flexion at hip joint. So here we can look that there is some extension of the thigh, due to which we have footling breech. So just revise this, note the attitude of the characters, and you are done with topic.